Hello doctors, welcome back to the series of NEET MDS 2021 Recall. In this video, we are going to see about the classification of furcation involvement in the teeth from the subject periodontics. So this topic is really very important from exam point of view and as well as for our daily clinical practice. So the question they have asked in previous exam was, which of the following statements are incorrect for furcation defects? So we have to find the incorrect statements from the 4 statements given below. So the statements are: grade 3 defect is clinically visible. Grade 1 is visible radiographically as radio opaque. In grade 4, interradicular bone is completely lost. In grade 2, bone is attached to the dome of furcation. So these are the statements they have given. So let us just see about each grade of furcation involvement to arrive at an answer for this question. So the classification of furcation. The classification of furcation was given by Glickman. Okay, this is very important one. Glickman classified the furcation involvement into 4 grades: grade 1, grade 2, grade 3 and grade 4. So grade 1 furcation lesion. So the grade 1 furcation lesion is an incipient or early lesion of early stage of furcation involvement. It involves a suprabony pocket. So this is important and it primarily affects the soft tissue. So since it primarily affects the soft tissue, the bone loss may have occurred with increasing probing depth. So here you can see the increased probing depth. So normally the gingiva should be there till there here, but mild bone loss has occurred, like horizontal bone loss you can also appreciate from this radiograph, right? So that bone loss may be seen with the probe. So radiographic changes are absent. So here you can see, so the radiographic changes are completely absent. So this is what we can see, and all the space is visible at entrance to furcation. No horizontal component is evident on probing. Okay, so on space a probe will fit into the furcation, but we can't find any horizontal component, okay, as such, which is attaching, which is getting catch to the probe, so that we can define it as a furcation. Okay, so that is what is grade 1. Then coming to grade 2, it can affect one or more furcations of the same tooth. Okay, so it can affect one or more furcations of the same tooth. So what are the furcations that we have? We have buccal furcation, lingual side furcation, right? We have bifurcated roots, trifurcated roots. So based upon that, the number of furcations will also vary. So it is essentially a cul-de-sac. So okay, so this is very important. Grade 2 is a cul-de-sac. So you can see here with a definite horizontal component. So in grade 1 we have no definite horizontal component, whereas in grade 2 it is cul-de-sac with definite horizontal component. Hence we will get a catch for the probe. Okay, so if multiple defects are present, they do not communicate with each other. So they do not communicate with each other because a portion of alveolar bone is still attached to the tooth. So extent of horizontal probing determines whether the lesion is early or advanced. So depending upon the probing depth, we can see whether the lesion is early or advanced. Vertical bone loss may be present. So here you can see in the radiograph there is a vertical bone loss. Radiographs may or may not depict furcation involvement. So but in this radiograph we can easily see the furcation involvement, but it may or may not depict the furcation involvement. Okay, then coming to grade 3. So grade 3 furcation is a through and through lesion. So through and through lesion means nothing but the probe will come from one end of the furcation to the other end. So we can easily do that thing with the probe. So is one of the most difficult periodontal lesions to treat and have poorer prognosis. So it has a very poor prognosis. In early lesions, opening may be filled with soft tissues and may not be visible. Okay, bone is not attached to dome of furcation. In bone grade 3, bone is not attached to dome of furcation. Dome of furcation is nothing but we have a root like this, right? This is the furcation. So this is the furcation dome. Okay, so this point is called as furcation dome. In grade 1 and grade 2, we have bone which is attached to the dome of furcation, but in grade 3 bone is not attached to the dome of furcation. We can see that from the image here. So right, the bone is not attached to the dome of furcation, hence because of that only the probe will go through and through the lesion. Okay, so the clinician may not even be able to pass probe completely through the furcation because of interference with bifurcational ridges or faciolingual bony margins. Okay, sometimes the clinician may not be able to pass the probe completely because of these. Radiologically, a radiolucent area in crotch of tooth. So we can see it here completely, like there is vertical bone loss. Along with that, a radiolucent area is clearly visible in the crotch of tooth. So this is what is grade 3 furcation. Then coming to grade 4 furcation, we can see the image here, right? So grade 4 furcation is interdental bone is completely destroyed. So we can see here, interdental bone is completely destroyed. Soft tissues have receded apically so that furcation is opening. Clinically, it is visible. Clinically, the furcation involvement is visible. A tunnel exists between roots of such affected tooth. So we can see a tunnel like thing. So it exists between roots of such affected tooth and probe passes easily from one aspect to the other. Okay, so this is what is grade 4. So coming back to the question, which of the following statements are incorrect for furcation defect? Grade 3 defect is clinically visible. Is it clinically visible? Let us see that. Grade 1 is visible radiographically as radio opaque. Yes, sometimes it is visible as a radio opaque lesion. Grade 4 interradicular bone is completely lost. Yes, it is right. Grade 2 bone is attached to dome of furcation. Of course, it is right. Grade 3 defect is, it is not clinically visible. Okay, grade 3 is not clinically visible. When we pass a probe through the furcation defect, then we can see the probe passing through the furcation in a through and through manner. Okay, so we can see the probe passing through the furcation in a through and through manner. So this itself is the clinical diagnostic category. Okay, but we can diagnose it based on radiographs also, right? As we have seen the radiographs previously, we can also diagnose it based on the vertical bone loss that we see radiographically and a crotch-like radiographic lesion appearance in the furcation region. So this will help in detecting the grade 3 defect. Okay. If you like our video, do subscribe to our YouTube channel. You can also follow us on Instagram at Dogshala for dental content and at Dogshala Medical for medical content. You can also find us on Telegram. Thank you.